Hi, my name is Alexis Cruickshank. I am a ASAP certified medical lab technician. I am attending Winston-Salem State University, and I have prepared this presentation for the course CLS 4102 Methods and Procedures. I am presenting my proposal about malaria and how detection and treatment outcomes can be improved by combining the use of rapid diagnostic testing and traditional microscopy. So, malaria. It is a disease associated with illness and suffering. It affects a significant portion of the world's population, particularly in Africa and Southeast Asia, but it also poses a threat in other regions across the globe. On average, millions of people are affected by this preventable yet deadly illness every year. But what exactly is malaria? It is a life-threatening disease transmitted by the female Anopheles mosquito. When an infected mosquito bites, it injects sporozoites into your bloodstream. These sporozoites are parasites of the Plasmodium species, the root cause of malaria. While there are 5 species of Plasmodium that cause malaria, 2 stand out the most as the most dangerous: Plasmodium falciparum and Plasmodium vivax. Plasmodium falciparum is the most dangerous. It is responsible for the majority of malaria-related deaths, especially in Central Africa. Plasmodium vivax, on the other hand, is more common in Southeast Asia, the Americas, and Latin America. The symptoms of malaria can range from mild, think fever and chills, to severe, including jaundice and even kidney failure. What makes malaria even more challenging is that the symptoms can be delayed, sometimes appearing weeks or even up to a year after the initial mosquito bite. In areas where malaria is endemic, it's common to see people who are asymptomatic carriers, showing no symptoms at all. So, how do we know if someone has malaria? How do we move from suspected symptoms to confirmed diagnosis and ultimately effective treatment? There are several tests available, but one stands out as the golden standard. For decades, the gold standard for malaria diagnosis has been the microscopic examination of blood smears. It is cost-effective and can help identify the specific Plasmodium species. This is incredibly important in resource-limited settings where malaria is most prevalent, and results can be available within hours of sample collection, allowing for rapid diagnosis and treatment. When a patient presents with malaria-like symptoms, a blood sample is collected, either through a simple finger prick or a more formal venipuncture. The sample is then used to create 2 types of blood smears, thick and thin, which are examined to identify the specific Plasmodium organism. But microscopy isn't without its challenges. According to the World Health Organization, traditional microscopic examination has a few key downsides. The sensitivity and specificity of the test can vary, meaning it's not always perfectly accurate. And crucially, the results depend entirely on the skill and experience of the laboratory technologist performing the examination. This is especially bad in remote areas where access to trained personnel and well-equipped labs can be limited, leading to misdiagnosis and delayed treatment. Enter rapid diagnostic tests, or RDTs for short. These simple portable tests offer a solution for faster diagnosis, even in resource-limited settings. RDTs provide results within minutes and have a high sensitivity and specificity for detecting Plasmodium infection. This can significantly accelerate treatment, but RDTs are not a perfect solution. They can struggle to detect certain strains of Plasmodium falciparum, and their accuracy can be affected by factors like temperature and humidity. So what's the answer? My research suggests that the most effective approach is to combine the strengths of both RDTs and microscopic examination. This may seem like the obvious answer, but lately RDTs have begun to replace microscopy altogether, which is a shame because both methods have their pros and cons, and combined testing can benefit a great deal of people suffering from malaria. For instance, RDTs can serve as a first-line screening tool, rapidly identifying likely cases of malaria. Microscopy can then be used to confirm diagnosis, identify specific species, and quantify parasite levels. RDTs help us quickly identify patients who need immediate treatment, while microscopy allows us to confirm the diagnosis and monitor the effectiveness of treatment. But how does traditional microscopy compare to other diagnostic techniques? A recent study conducted in India sought to evaluate the performance of 4 malaria diagnostic assays: PCR, quantitative Buffy coat, rapid diagnostic tests, and peripheral blood smear microscopy. Researchers aimed to compare the efficiency of each assay in a real-world setting. The findings were published in 2024 by Chawla, Khanna, and Iyer. The study involved 117 patients presenting with clinical symptoms suggestive of malaria or suspected relapse cases. Each patient underwent testing using all 4 assays concurrently. The results from each assay were then compared against and confirmed by PCR. The study suggests that PCR, or RDTs, should be the main diagnostic assay or used in conjunction with PBS for increased accuracy and reliability. Although there is a higher cost associated with PCR and RDTs, it will increase the opportunity to properly diagnose malaria cases. So, this study focuses on the specificity and sensitivity of a rapid diagnostic test and analyzes its effectiveness of being utilized alongside a traditional microscopic examination. This study aims to evaluate the specificity and sensitivity of an RDT in malaria diagnosis, focusing on 1,000 participants from sub-Saharan Africa and remote areas to ensure a comprehensive range of data points over a year. The participants will undergo blood collection for both microscopic and RDT tests. Microscopic examination involves drawing an EDTA tube from a participant with malaria symptoms and examining 2 slides for parasites. If positive, participants will be asked to provide another blood sample for RDT studies. RDT tests focusing on histidine-rich protein 2,3 will be conducted using a CareStart cassette. The cassette has a sample well and buffer well, with dye-labeled antibodies visible if the target antigen is present. Results will be available within 20 minutes, depending on the amount of antigen present and parasite density of each population. When analyzing the cassettes, positive HRP2 bands were considered positive for Plasmodium falciparum. Participants with negative HRP2 may consent for further studies focusing on the HRP2/3 deletion mutation. Blood samples were collected for DBS preparation, and quantitative PCR assays were performed to confirm Plasmodium falciparum DNA presence. And additional data was collected for a correlation chart. In summary, prioritizing accessibility and accuracy is crucial. By improving diagnostic accuracy, we can reduce unnecessary treatment and ultimately save more lives. The fight against malaria demands a multifaceted approach. By carefully considering the limitations and benefits of each diagnostic method, and by prioritizing accessibility and accuracy, we can make real progress towards a malaria-free future. Thank you.